Hey everyone, welcome back to Ignite Your Spark, the video podcast. I'm really excited to be back in this space. I stopped my podcast. There's still millions out there, not millions, but almost 200. And we're going to be doing some video ones. And my first guest is Dr. Katie Kennedy. And when I met her, I thought, I have to talk to her about her fabulous product that she has developed. But I want to tell you about Dr. Katie. Dr. Katie Kennedy is a double boarded pathologist in both anatomic and clinical pathology. And her dad, was also a pathologist and she followed in his footsteps. And for many years, she practiced in the community hospital setting in Florida. And she's seen it all the diseases from acute and chronic disease to every type of malignancy. In fact, pathologists are known as the doctor's doctor because these medical teams rely on the pathologist to determine the correct diagnosis for these difficult cases. Recently, she has switched because of some of her own health issues to the preventative medicine and wellness space. I love a good holistic practitioner. Believe me, anything we can do to help us stay young and healthy, come on, who doesn't want that? Dr. Kennedy has created this incredible product. And this isn't a commercial for the product. It's just that I think it's fascinating, called Beauty Balloon, the Triangle of Youth. And we're going to learn all about it and her story. Welcome, Dr. Katie. Thank you for being
Thank you,
here.
Kim. So fun to be here. I was so looking forward to this. I know, to talk all things head and neck health.
All right, we're going
Right?
to talk about, well, how did you get into wanting to do something it's for the head and neck, which I did not say, but to do this for people? What prompted you to create it?
Absolutely. Really a lot of things going on. First of all, I am a lifelong allergy sufferer. Way back as a kid, drainage, open mouth breathing, waking up with literally, Kim, my hair matted in my pillow and saliva in my hair. So I've struggled with allergies my whole life. Anybody close to me knows this. I have boxes of tissues everywhere and just constantly have to manage it. It's a something that I just have to manage, and I do with nasal saline flush and my tissues. So as I got to perimenopause, menopause, I started to notice oral changes. I realized I was snoring. So I was having that open mouth, unhealthy position, which is a sign of dysfunction. Okay. And so I knew in my health, cholesterol high, triglycerides, pre-diabetic, really just going down a bad pathway, and with snoring in the open mouth position contributing to a lot of this issue. So I knew I had to make some changes, started doing some of these exercises to strengthen up my oropharynx, strengthen up the tongue. But I wasn't getting to where I really knew I needed to be, where I wanted to be. So I started to try a couple of different things and they weren't working, and hence the name balloon. I started with it being a balloon, which in pathology, we get all the materials that are removed from the body. So I see a lot of little balloons. We use them to open up the esophagus. We open up blood vessels, cardiologists, interventional radiologists for angioplasty. So we have a balloon, a medical grade type of balloon for every orifice you can just about think of in the body. And so I thought, oh, well, we'll be able to do this. I can figure this out. Well, it wasn't working. The shapes weren't working, the cylindrical shape. So I said, okay, I need to switch gears. And it was what dawned on me one day. I was looking at the arch of this building I was in, the structure of the arch. And they had triangles, Kim. It was triangles that was the support structure for the arches. Then it dawned on me, the arches in the palate, right? The palate is an arch, the dental arch, the palatal arch. We have perpendicular arches in the oral cavity. And turns out the triangle is one of the most stable geometric shapes, as is the arch. And they complement so well together to manipulate in and around to get to these hard to reach muscles. So I like to say it's a little TLC for your TLC, meaning a little tender loving care for your tongue, lips, and cheeks. So that's what I've coined it. And so we want to take care of this area. We want to have a strong lip seal for a lot of reasons, so we don't snore. part of snoring is you want to have a strong tongue to keep it up out of the airway, up on the palate. You want to keep your oropharyngeal muscles strong because that is what causes the sound of snoring. So you can hear, noisy snoring is because your muscles are weak and floppy. And so it creates that sound. So if you have strong muscles and very tone, you bring back the tone into your throat, if you will, that will help to reverse this. But the key part is you also have to have a strong lip seal. And that's why you see so many people using mouth tape.
Yeah. Yeah. That's a
Mouth
thing
tape.
now. More and more you see that mouth tape. A lot of singers, a lot of Broadway people because I love music and musical theater, I see them on Instagram and they'll show themselves putting their tape on.
That's right.
And
Athletes.
does that help strengthen your muscles if you're wearing that tape?
Well, it does not because you're not moving the muscle. It's just a Band-Aid. Now I don't need that. And I can sleep straight sitting. I can sleep up on an airplane or with my head up against the door in the car, up against a pillow. And I don't have an open mouth position. And I wake up with a healthy, moist mouth. And that's what we want. We want all of this, the health benefits of nasal breathing. And so that's really what we want. We want to nasally breathe
Okay, yeah, you hear that nasal breathing is really important. How long have you been practicing with your triangles?
Well, I'd say it's probably maybe about a year, really full out, or a little bit longer that I've had these. But I noticed the changes really probably within maybe a month of really doing the exercise on a consistent basis. Now I will do something every day. I do a little bit every day. And so I created this because I would like for folks to do something every day. You're doing something for the body. We go for a walk every day. We're doing something. We want to move. This is just part of movement, Kim. It's just an extension of movement. We move below the clavicle. We want to move up here. And just our normal walking to the kitchen or our normal talking isn't really enough. We want to add resistance to the skeletal muscle.
Because it's like weights. We need to use weights to develop resistance. Now, also, I know that you've worked with face yoga has become kind of a bigger thing, and this is sort of an adjunct to that, isn't it?
Absolutely, absolutely. And what I noticed in the face yoga market, in the face yoga niche, if you will, or space, what I noticed, a lot of the movements that they do, especially the tongue movements, the tongue and the talking about posture and preventing forward head tilt, which we're all guilty of with our head down in our phones all day long. They're doing preventative medicine, whether or not they label it or not. I'm going to call it that because that's what I see with what they're doing. So they're really doing a great service. They're doing a really good thing for overall health and fitness. A lot of the moves, Kim, are similar to what I would see on our neuro floors, rehab floors, in the hospital setting, in these other types of facilities where they're working with patients that would have dysphagia, which is difficulty swallowing from a weak tongue, where you might have a little coughing or maybe a little sense of choking, and it may be very gradual, very mild over time as we start to age. Because our tongue muscle will weaken, all of these muscles weaken and atrophy, no different than below the clavicle. So I was noticing a commonality with our speech and language pathologists, PT, OT, physical therapy, occupational therapy, and with some of the moves that I saw over in the face yoga world. And I thought, gosh, this is really exciting. This is great stuff. And they're helping so many people by doing that. Even if they don't really realize it, they are strengthening their airway when they're doing a lot of these moves. And I thought, for me though, I needed a tool. I'm a tool person. I need a tool. And so that's why I created it. I wanted to add the resistance, and then that took it to the next level. And it worked so well, Kim. I said, I want to bring this to market and share this with people. And hopefully this will really help a lot of people that want to do prevention, so they never have to deal with some of these health issues that we're talking about. Or if they are struggling, if they've had a stroke or Bell's palsy or any of these other types of issues, the neurodegenerative diseases, Alzheimer's disease, Parkinson's, dementia, where you can get these types of paralysis or weakness with these types of diseases, this will help keep that strength and keep that function as best as they can. So lots of uses, lots of uses.
So if someone has Bell's palsy
Mhm.
and this will help strengthen, have you seen that help?
Well, that can help with bringing back the function, right? Because with these types of paralysis, we're talking about facial paralysis, you have that loss. And so
Yeah.
it can take time to recover from that. It can take weeks or months. Everybody's going to be a little bit different. But boy, if we have a simple tool to use to bring back that side that is the weaker side. And what I love about these is that you can use them, we call it unilaterally or bilaterally, using it unilaterally on the one side where the weakness will be to help bring back that function. And we want to bring those functions back fast, right?
Yeah.
We want to bring those fast. We want to be able to eat. We want to be able to chew. We want to be able to speak and interact. The last thing you want is for a patient to have social isolation because they're having these types of issues. So that's all on the health end. And so this is why I love this topic. This is because it spans so much. It just spans so much. That's why I call it a health and a beauty tool.
Yeah.
And so
Yeah.
it's
Let's talk about I mean, I love this because I actually have noticed sometimes I'll get that sort of
we have to clear your throat.
yes, what is it with us older people? We have to clear our throats. I'm like, that just sounds so old and I don't feel old. So why is that happening?
Well,
This is part of it. It's the
right.
muscle.
Start doing some of these tongue strengthening tools, and you will regain and bring back that nice, strong swallow pattern, which is what we want. We want a nice, strong swallow pattern. We want those muscles to work in harmony together. And so all of the oral functions, and these are the things that I have anecdotally noticed for myself, Kim, too. I can clear out my food better when I do the tongue sweep. It's
Yeah.
easier to push food bolus. I have no issues with ordering the big crunchy salad at a restaurant. All of these types of issues that as we approach into our more mature years, we don't want to convert to eating soft foods and
No.
eating purees and living like that. Greater, I'll give you a number, greater than 50% of our nursing home population has dysphagia and it's weak tongue. So let's not go there, right? We don't want to go there.
No.
So these are great ways for us to stay strong and fit in the head and neck region. It's not in what so
Well,
it's great.
before you demonstrate, also, didn't you say like it can kind of help with wrinkles?
Yeah, well, this is what is the double benefit of keeping muscles tone, right? This is talking about keeping muscles tone. And when we do that for the body, we can help our abdomen look better, our biceps look better, our triceps look better. It's skeletal muscle up here as well. This will help shape, contour, help define a little bit better on the jawline. So these are all the other aesthetic benefits. And we know, Kim, of course, let me just share this with everyone, the triangle of youth and what that means in the world of aesthetics. So now if we jump over to our dermatology and plastic surgery world, this is the gold standard for them. They want to define the jawline, right? They want to have the weight of the face more upward,
Yeah.
right? So we want to maintain the triangle of youth, high cheekbones, full cheeks, defined jawline, and not do this where we would become the pyramid of age where everything goes south, right? We don't want that. And so, it's not plastic surgery. And, I'll say that, but let's take what we can get, right?
Yeah.
I think anybody will take what we can get. And so let's avoid the pyramid of age and let's work on the triangle of youth. Exactly. So to bring out some contours and some lifting and shape. Yeah.
I love it. And it really can help you. It's like, I guess it's true. It's like you can always develop muscle in your arms. So why couldn't we always develop muscle in our face?
That's exactly right. It's voluntary skeletal muscle. And when you add in resistance to voluntary skeletal muscle, it will respond, period.
Oh my gosh.
I know. So like I said, we'll take what we can get and, build that robust, and it brings in blood supply, so many other little little wonderful benefits that you get. More of that. The skin will look a little better because you're bringing in the blood supply. I've noticed for me, I think I had mentioned this to you, my lips, I no longer have chapped lips because my muscles are very strong. I like the way my lipstick lays on my lips better. I don't have that flaky, dry lip. That's what I've experienced. And other little odd things that I didn't anticipate. I don't have saliva that collects in the corners of my mouth, and I don't have that accidental,
Yeah.
uh, we all have done it. We've all done it. And so I don't have some of those issues. And it's just, those are some other little extra nice benefits on top of some of the other wonderful health benefits that I get with a closed mouth position. Dehydration, Kim, we avoid dehydration. We know that's a real issue for our demographic I'm 58, folks. And so as we get older, we don't want to be dehydrated. And our hypothalamus, which is the responsible for the thirst mechanism, doesn't work as well as we age. Like I'm never thirsty. I don't ever feel thirsty. And so sleeping all night with an open mouth will just dehydrate us even more. And so there's a lot of health problems that come with that as well, which I could go on and on about, but
well, let's do some demonstration. Let's do a little bit of demonstration.
Absolutely.
So like how many minutes a day should you sort of do this?
I would say when you first get the tools, and you do get the exercise booklet, which has a little shy of 30 exercises, which is too many and can be overwhelming. Just pick your favorite 5, pick your favorite 3 to 5, start with those, do those for a few days, then switch and then do another different batch of 3 to 5. Find the ones that you like and then stick with them and work on the areas the most that you want. And so let's just do the lip. I really like this one. I'm going to put the whole unit, Kim, tucked underneath my lip. So the base is going to be tucked in underneath my upper lip.
Okay.
Apex below my lower lip.
All right.
And I'm going to say, oh, and this lip muscle is a round muscle. So we can hypertrophy it and we can bring back more balance and more symmetry, which helps on the functional end and on the aesthetic end.
Oh, I can tell you I'll be doing this. Yeah. Okay.
And when we ever go, it's just a slight rotation in and out. How I get it in and out, it's a slight rotation. I use my index and thumb and I grab the apex and I'll just rotate it in and then I'll slide it up underneath my upper lip and lower lip. So this is how I'll do it. And I say, oh, there you go. Oh,
it's falling.
And then just hold it. And you'll notice what just happened there. I'm kind of glad that happened because I want folks to see that, Kim. At first, you're weak because you're weak. Over time, as you build that strength, you'll be able to hold the triangle in place. But for now, just use your index and thumb to keep it in place as you build your strength. And that's expected. That's absolutely expected. So I know that's absolutely, but look at how
time. I'm the first time.
Exactly. And I expect that. That's exactly what I would expect. You'll have women will have a hard time being able to hold the whole unit. And so what we can do, there you go. Perfect. You can just do half at first.
I got it.
And
And
then you can work up to it. And then what I like to add, and it looks funny, and we can do these in the mirror. I always tell people when you first learn, shoulders down, just like you would in the gym, good posture, shoulders down, no need to squint our eyes, no need to raise our forehead. So we're really focusing in this area and we're focusing on the muscle. So we get this in shape. And like I said, we have that nice, pretty closed mouth position because the lower lip supports the upper lip. And so when they're separated, the upper lip is not getting the support that it needs. So we really want that closed mouth position. But I love that one. And then I'll add a cheek pop. And that will be a little bit challenging too, Kim, probably for you as well. So we'll say, oh, and then you can add the cheek contraction, which helps lift the cheek. So I'll just show you that.
Yeah, show.
We'll show. Okay. Oh, and then
Oh, I'll do that off camera. I'm not sure I want to show that. Oh my.
Right. This will help. You'll get more tone and more lift over time. And that's something to work up to. Again, it takes time for muscles to build up,
Yeah,
just like if we're lifting muscles, right? I mean, we start out with maybe 2 pounds and we work to 5 pounds, then we work
right.
to 10, and then we work to 15. It's no different. It's just the muscles are a little bit smaller. And the
This was,
anatomy.
I wanted to wait to do it until I saw you, until we did this. That was my first time. So, I do, it's like their first time working out. I love to work out, so I love that feeling, but I feel like more, it's like going to yoga and stretching. It feels really
Absolutely.
good. All right.
Absolutely.
So,
And
that's,
yes, and the bonus, Kim, it rubs the gum. It's like a gum massage too.
yeah, I
Get
felt
your
like I was
saliva,
getting a
you
little
get your
facial
saliva,
action.
everything. Right. Absolutely. It's all good to work. Movement is our ticket to health. The minute we stop moving, and
Yeah,
that's movement everywhere, right? We know
everywhere.
game over, right? We know we got to get up out of the chair. We got to keep going. And it is, if you're frail below the clavicle, you're going to be frail above the clavicle, or sarcopenic. Sarcopenic is the medical term, right? It's when we really see muscle loss and muscle deconditioning. It doesn't stop here. And this is the message that I want to bring forward to everyone, that we can take care of this in the same similar type of manner we take care of our muscles and bone below the clavicle. So,
Great. All right. Before
yeah.
we wrap up, so we have this tool and we have this tool.
Uh-huh.
And how many different exercises are there?
Well, like I said, there's probably at least 50.
Oh
There's
my
probably
gosh.
50 or more. And so like I said, we just are going to do a few simple ones, but there's so many neat little ways that we can manipulate the tools. And
Yeah,
it's unlimited for what we can continue to do. If people are really interested
I
and
love
want
it.
us to continue, we can absolutely do these fun sessions. And I want it to be, it's positive. It's a community. We stay motivated. We all stay more motivated if we're walking with friends, going to the gym with friends, and
Yeah,
we can do this across the screen. This is
yeah.
what's fun. It doesn't matter if you're in California, if we're in New York, we can all still get together. And that's what I'm building toward. I'm building the community, the beauty balloon community.
All
So
right. I love it.
uh-huh.
Let's do one more exercise.
Let's do the 2-step, Kim, where you open up the butterfly, because this is really great for the tongue. It's going to go in one hole. It's always opposite because it's resistant. So the tool goes in one direction,
Ah.
tongue goes opposite. So, and then hold for 5. Huh, 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 huh. And you stick it all the way in. And then, yep, your tongue's going that way and tool goes that way. Huh, 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 huh. And
Huh.
bring it close to you. Uh-huh. Huh, 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 huh.
Ooh.
Yeah. Ooh, is right.
I'm a tongue practitioner now.
Uh-huh. Exactly.
Wow. And then
Whoever knew the tongue was so important, right, Kim?
I
This
know, I know.
quirky organ, whoever knew. It plays such a role with health, aesthetics, whoever would have known.
Well, but I mean, no longer will we be tongue tied.
Yeah, I know, right? I know, exactly.
All
So
right. And
that's a really
there's
fun
one
one.
where you push your tongue.
Uh-huh. Yes. So, and that one, my kids help me name some of these funny names. The slingshot. So you're going to push
Yeah.
on the attachment site with the tongue and pull the tool back again, hold for 5 seconds. You can do reps and hold it. So either one. So you get that springy. And see how
Uh-huh.
this is springy? So push as hard as you can. And again, you're strengthening the tongue against resistance. Mm-hmm.
Okay. Fascinating. Whew. Yeah.
Uh-huh. I love that, right?
Yeah.
All of these. And it just goes on and on. The tongue can go through the triangle, over the triangle. There's so many different ways that we can strengthen things. Yep, exactly.
It's
And
great.
yeah,
I'm going to keep it on my desk and just do it whenever I'm just sitting here working because do not want that, aphasia or what do you call it?
right.
Dysphagia.
Difficulty swallowing,
Yeah,
right?
I don't
Difficult
want that.
steak and common foods. You'll see this with chicken, right? A piece of chicken or a piece of meat or steak.
Yeah.
You'll feel like something might be getting stuck in the back of your throat.
Yes.
And right. And I'll tell you, I had a woman who bought the product. I'll just tell you this quick story, Kim. She bought the product in December She reached out to me, I guess it was February. She bought it because it caught her eye about the tongue. And
Yeah.
she bought the tools and she focused just doing the tongue chapter because she explained she was waking up in the middle of the night choking on her saliva.
Mm-hmm.
And it was very scary for her as she was explaining. Focused on doing the tongue exercises. She no longer has that issue.
Oh my gosh, I love that. That's a great testimonial. That's
It's a
perfect.
great testimonial. And
Yeah.
I was so happy for her, but that's why I created it. That's why I brought it to market,
Yeah.
because that's what I anticipate if folks start to use this. And, I'm not her physician, of course, and I don't
Right.
know what her diagnosis was, but I think it just shows you what movement, healthy movement, right? We're moving our voluntary skeletal muscle exercise, what it can do for your health and fitness, and head to toe. We want
Yeah, I love it. I'm so excited to really work on this and do this. And people can find you where?
Yes, people can find me on Instagram. Follow me on Instagram, Your Triangle of Youth. Your Triangle of Youth. That's how you'll remember it because it's a triangle. And then the website is beautyballoon.com.
Great. I'll
Beautyballoon.com.
I'll put it all below, all your
Yes,
information.
yes. And we're talking about all different topics, Kim, from stroke, all the real hardcore medical topics, of course, which is my background, but then some of the lighter, funner topics of aesthetics,
Yeah,
right? Just fun little things that we can share on aesthetics too. So lots of fun. And TMJ is in this whole conversation as well. Those
yeah.
that are suffering from TMJ can benefit from doing these types of exercises. And it's so many. It's
Oh,
overwhelming at first, but it's a newer niche, Kim.
yeah.
I want to mainstream it. I want it to be like we brush our hair every day, we brush our teeth, we do a few minutes, and it can be less than 10 minutes. 5 minutes in the morning, do 5 or 8 minutes at night, and then you can get it down to one day, but do a little bit of something every day.
I'm going
Um,
to. I'm going to start
you
that.
know. Mhm.
Dr. Katie, thank you. I love it.
Uh-huh. What?
Yeah, it really works at all, doesn't it? Ooh, that's cool.
I know.
Well,
Lots of fun
thank
ones.
you. Thank you for your time. And thank you all for watching this. I hope you learned
So
something. I'm
fun.
all about
So fun.
staying young as long as we
Yes.
can. And
Yes.
I care about looking good. So maybe you do too, but
Of
it's
the
really more
benefits.
the health. I mean, I want to be
Yes.
healthy. That is my prayer every day. Keep me healthy.
And
So
stave off those diseases. Stave them
yeah,
off, Kim. That's right. Don't
absolutely.
let them come our way.
Right. Oh my gosh. Well, thanks, Dr. Katie. Thanks,
Thank you,
everybody, for
Kim.
tuning in. See you next time. Shine on.